Hey everybody. So I know that this is something I talk a lot about, but I really want to hammer this home, and I'm going to continue to hammer this home until we start to make some actual changes in the way that pain management is handled today. So it is a huge fallacy to have a patient who is in pain not perform a good, thorough physical exam, to just go and get imaging like an X-ray or an MRI, and then to take those two pieces of information, which is the person has back pain, and I took an MRI and it shows a disc protrusion or a bulging disc or a herniated disc or degenerative disc disease, and all of a sudden just say to that patient, oh, this is what's causing your pain, and so here are your options on what to do, which a lot of the times is just grin and bear it, or NSAIDs or cortisone injections before a surgical consult or something like that, without even taking into consideration the factors that make the factors that will essentially show us how a patient is presenting their pain. And so what I mean by that, which I clearly just botched that, but what I mean by that is this, is pain that is from an actual disc generally almost always gets worse bending forward and is better when patients extend and bring their kind of chest up towards the ceiling. And that those patients are also generally going to feel better when they're lying flat on their stomach. That is the exact opposite of what happens when patients have pain coming from the facet joints. They actually feel better going forward, and they feel worse extending their lower back, and they can't lay on their stomach because that puts them into a mild extension, and that irritates the facet joints, which causes them pain. Now, if a physician doesn't clarify those types of things with the physical exam, with good thorough history taking, and then they just take the MRI and it shows degenerative disc disease and disc herniations, if they don't realize that the patient's pain is worse in extension, better with flexion, which would indicate a potential facet syndrome, then they're just going to apply what they found on the imaging over onto the patient and send them down a path of potentially 10, 20, 40 years of chasing this pain because the initial diagnosis was never truly made based off of history and physical exam. And so I really encourage you that if you're working with a provider, if you're not even working with a provider, if you've been in chronic pain and the therapies that have been recommended to you have been based mainly off of an MRI image, an ultrasound image, an X-ray, a CT, and you have not worked with a provider who has put you through a rigorous enough physical exam where afterwards the physician can tell you, I suspect or I think your pain is coming from this tissue, whether that's the cluneal nerves, whether that is the facet joints, whether it actually is a disc herniation, whatever the cause is, that they should be able to give you some approximation of this is where I think your tissue pain generators are, and therefore we can proceed down these avenues of treatment. Please remember this as you are working with providers, because I want all of you to not be in chronic pain and have to suffer through, quite frankly, a bullshit approach to how we deal with chronic pain in this country. See you later, everybody.